Hey, I'm Dr. Shawn Rennick, and sitting here with my colleague Roma Oleksyn, who's a physiotherapist, and I'm a chiropractor. And at Action Sports Clinic, we are often asked the question about, what is the difference between chiropractic and physiotherapy and/or massage therapy? But we're going to talk a little bit about chiropractic and physiotherapy and how they can work together. So Roma, my esteemed colleague, has all the answers.
Well, I think a lot of times everybody's looking for the difference between these two professions, but I'd like to think at this clinic that we present a very unified treatment approach for the patient. Whether or not that's putting our hands on them to mobilize, glide a joint, remove adhesions from soft tissue, or whether or not you're doing manipulation, is that we're hands-on here. Would you like to speak more about that?
Well, I think you raise a good point, about being hands-on, and in a sports clinic like this, because we're dealing with lots of different musculoskeletal conditions, we're both going to do proper assessments, examinations, arrive at a diagnosis and some sort of treatment plan and strategy to help the patient get better. So if something's stuck, if a joint's stuck, we're going to get it moving. If something is weak, we're going to try and teach the person how to strengthen it, right?
Yeah, which is actually an excellent point for me, just if I can interject, is actually the value that we all place as practitioners here in the clinic on exercise. Not only do we do it ourselves, so we practice what we preach, but we're also guiding patients on how they can take that restored motion, that improved muscular length, and strengthen and hold the fix.
Exactly.
Yeah.
So once we fix it, we're going to try and strengthen it and build it up around that, whatever that joint is, or if there's something that's damaged. So
definitely.
Yeah. And that's maybe the strength. Between the professions in our setting, anyways, that we do integrate, and there's a seamless approach. Whereas oftentimes you have, physical therapy practitioners who are working in a physio-only clinic, where you have chiros who are just, focused on doing manipulation or adjustments only, and whereas I think in our practice, each person and each physio and myself, we have slightly unique strengths and characteristics that really we are able to blend and mix and match and some of those approaches that ultimately help serve the patients better.
Yeah, and it's a really good point, Shawn. So in the course of my time here at this clinic, what I've seen is that when a patient comes in the door, is that assessment is going to guide them around who they need to see and what they need in the clinic. So whether or not that is something like a manipulation from you as a chiropractor, or that is IMS, intramuscular stim, whether or not it's a massage, maybe some active release techniques, exercise, we're going to send them around the clinic so that happens, and using the skill sets of our colleagues.
And the cool thing I've found too is that in doing this multidisciplinary approach is that you'll communicate with me, we'll have a case, someone will come in, and we'll have something that we need to talk about, but it's more in keeping with what your approach is versus my approach, or vice versa. And so we're able to quickly have a little rounds meeting about that case and say, okay, I'm going to try this. Let's see if we can move this patient to this level, and then you teach them this, or I teach them this. So that's something that we like about working together as a team, is that we have this approach, and we really try and integrate care. And I think people ultimately generate the best outcomes from that. There's another thing.
It's really efficient, right?
It's efficient
for our consumer. We're in the core here. People's time is valuable, and we want to make sure that they're coming in and that they're getting the best treatment and the most efficient care.
Efficient care. Sometimes financially too. I was just thinking.
Yeah, that's a really good point. We should talk about that.
Oftentimes the patient will. They may have a certain amount of cash available from their, their insurance, and they run out of physical therapy coverage, but they might have chiro coverage. In which case we can dovetail those two services together and still try and move the patient toward their full health, right?
Yeah,
or their potential.
Absolutely. Yeah, and again, just I know our colleague who's a massage therapist isn't here, but she's certainly a lot of value in this clinic and adds those soft tissue techniques to relax and restore a sense of wellness to our patients as well too.
Absolutely.
So, yeah.
Well, thank you. I just wanted to touch on that.
Yeah.
That was great comments. So if you need either chiro or physio or massage therapy, definitely give us a call, 403-263-2225. If you have any questions, you can email us. If you go onto our website at www.actionsportsclinic.ca, You'll find the contact information there, and you can email us if you have a question about a certain approach, or if there's a modality, or there's something that you have a question about regarding treatment. Just give us a shout.